hadn't changed his positions on it. No, but he's for weakening it. I don't think my opponent has got the right view about the world to make us safe. I really don't. First of all, I don't think he can succeed in Iraq, and if Iraq were to fail, it'd be a haven for terrorists, and there'd be money, and the world would be much more dangerous. I don't see how you can win in Iraq if you don't believe we should be there in the first place. I don't see how you can lead troops if you say it's the wrong war at the wrong place at the wrong time. I don't see how the Iraqis are going to have confidence in the American president if all they hear is that it was a mistake to be there in the first place. This war is a long, long war, and it requires steadfast determination, and it requires a complete understanding that we not only chase down al-Qaeda, but we disrupt terrorist safe havens, as well as people who could provide the terrorists with support.
I want to extend for a minute, Senator, and I'm curious about something you said. You said it's not when, but if. You think it's inevitable? Because the sense of security is a very basic thing with everybody in this country, worried about their kids.
Well, the President and his experts have told America that it's not a question of if, it's a question of when. And I accept what the President has said. These terrorists are serious, they're deadly, and they know nothing except trying to kill. I understand that. That's why I will never stop at anything to hunt down and kill the terrorists. But you heard the President just say to you that we've added money. Folks, the test is not if you've added money. The test is, have you done everything possible to make America secure? He chose a tax cut for wealthy Americans over the things that I listed to you.
Mr. President.
Well, we'll talk about the tax cut for middle class here in a minute. But, yeah, I'm worried. I'm worried. I'm worried about our country. And I can tell you, all I can tell you is every day I know that there's people working overtime, doing the very best they can. And the reason I'm worried is because there's a vicious enemy that has an ideology of hate. And the way to defeat them long term, by the way, is to spread freedom. Liberty can change habits. And that's what's happening in Afghanistan and Iraq.
Mr. President, we're going to turn to questions now on domestic policy, and we're going to start with health issues. And the first question is for President Bush, and it's from John Horseman.
Why did you block the reimportation of safer and inexpensive drugs from Canada, which would have cut 40 to 60% off of the cost?
I haven't yet. Just want to make sure they're safe. When a drug comes in from Canada, I want to make sure it cures you and doesn't kill you. And that's why the FDA and that's why the Surgeon General are looking very carefully to make sure it can be done in a safe way. I've got an obligation to make sure our government does everything we can to protect you. And you know, what my worry is that, you know, it looks like it's from Canada and it might be from a third world. We just got to make sure before somebody thinks they're buying a product that it works. And that's why we're doing what we're doing. Now, it may very well be here in December. You hear me say, I think there's a safe way to do it. Other ways to make sure drugs are cheaper. One is to speed up generic drugs to the marketplace quicker. Pharmaceuticals were using loopholes to keep brand drugs in place, and generics are much less expensive than brand drugs, and we're doing just that. Another is to get our seniors to sign up to these drug discount cards, and they're working. Wanda Blackmore, I met here from Missouri. The first time she bought drugs with her drug discount card, she paid $1.14, I think it was, for about $10 worth of drugs. These cards make sense. And you know, in 2006, seniors are going to get prescription drug coverage for the first time in Medicare. Because I went to Washington to fix problems. Medicare, the issue of Medicare used to be called Mediscare. People didn't want to touch it for fear of getting hurt politically. I want to get something done. I think our seniors deserve a modern medical system. And in 2006, our seniors will get prescription drug coverage. Thank you for asking.
Senator, a minute and a half.
John, you heard the President just say that he thought he might try to be for it. 4 years ago, right here in this forum, he was asked the same question. Can't people be able to import drugs from Canada? You know what he said? I think that makes sense. I think that's a good idea. 4 years ago. Now, the President said, I'm not blocking that. Ladies and gentlemen, the President just didn't level with you. Right now, again, he did block it because we passed it in the United States Senate. We sent it over to the House that you could import drugs. We took care of the safety issues. We're not talking about third world drugs. We're talking about drugs made right here in the United States of America that have American brand names on them in American bottles, and we're asking to be able to allow you to get them. The president blocked it. The president also took Medicare, which belongs to you, and he could have lowered the cost of Medicare and lowered your taxes and lowered the cost to seniors. You know what he did? He made it illegal for Medicare to do what the VA does, which is bulk purchase drugs so that you can lower the price and get them out to you lower. He put $139 billion of windfall profit into the pockets of the drug companies right out of your pockets. That's the difference between us. The president sides with the power companies, the oil companies, the drug companies, and I'm fighting to let you get those drugs from Canada, and I'm fighting to let Medicare survive. I'm fighting for the middle class. That's the difference.
If they're safe, they're coming. I want to remind you that it wasn't just my administration that made the decision on safety. President Clinton did the same thing, because we have an obligation to protect you. Now, he talks about Medicare. He's been in the United States Senate 20 years. Show me one accomplishment toward Medicare that he accomplished. I've been in Washington, D.C. 3.5 years and led the Congress to reform Medicare so our seniors have got a modern health care system. That's what leadership is all about.
Actually, Mr. President, in 1997, we fixed Medicare, and I was one of the people involved in it. We not only fixed Medicare and took it way out into the future, we did something that you don't know how to do. We balanced the budget. And we paid down the debt of our nation for 2 years in a row, and we created 23 million new jobs at the same time. And it's the president's fiscal policies that have driven up the biggest deficits in American history. He's added more debt to the debt of the United States in 4 years than all the way from George Washington to Ronald Reagan put together. Go figure.
Next question is for Senator Kerry, and this comes from Norma Jean Laurent.
Senator Kerry, you have stated your concern for the rising cost of health care, yet you chose a vice presidential candidate who has made millions of dollars successfully suing medical professionals. How do you reconcile this with the voters?
Very easily. John Edwards is the author of the Patient's Bill of Rights. He wanted to give people rights. John Edwards and I support tort reform. We both believe that as lawyers, I'm a lawyer too, and I believe that we will be able to get a fix that has eluded everybody else because we know how to do it. It's in my health care proposal. Go to johnkerry.com. You can pull it off the internet, and you'll find a tort reform plan. Now, ladies and gentlemen, important to understand, the president and his friends try to make a big deal out of it. Is it a problem? Yes, it's a problem. Do we need to fix it, particularly for OGBYNs and for brain surgeons and others? Yes. But it's less than 1% of the total cost of health care. Your premiums are going up. You've gone up in Missouri about $3,500. You've gone up 64%. You've seen copays go up, deductibles go up. Everything's gone up. 5 million people have lost their health insurance under this president. He's done nothing about it. I have a plan. I have a plan to lower the cost of health care for you. I have a plan to cover all children. I have a plan to let you buy into the same health care senators and congressmen give themselves. I have a plan that's going to allow people 55 to 64 to buy into Medicare early. And I have a plan that will take the catastrophic cases out of the system, off your backs, pay for it out of a federal fund, which lowers the premiums for everybody in America, makes American business more competitive, and makes health care more affordable. Now, all of that can happen, but I have to ask you to do one thing. Join me in rolling back the president's unaffordable tax cut for people earning more than $200,000 a year. That's all. 98% of America, I'm giving you a tax cut, and I'm giving you health care.
Mr. President, minute and a half.
Let me see where to start here. First, the National Journal named Senator Kennedy the most liberal senator of all. And that's saying something, that bunch. You might say that took a lot of hard work. The reason I bring that up is because he's proposed $2.2 trillion in new spending, and he says he's going to tax the rich to close the tax gap. He can't. He's going to tax everybody here to fund his programs. That's just reality. And what are his health programs? First, he says he's for medical liability reform, particularly for OBGYNs. There was a bill on the floor of the United States Senate that he could have showed up and voted for if he's so much for it. Secondly, he says that medical liability costs only cause 1% increase. That shows a lack of understanding. Doctors practice defensive medicine because of all the frivolous lawsuits that cost our government $28 billion a year. And finally, he says he's going to have a novel health care plan. You know what it is? The federal government's going to run it. It is the largest increase in federal government health care ever. And it fits with his philosophy. That's why I told you about the award he won from the National Journal. That's what liberals do. They create government-sponsored health care. Maybe you think that makes sense. I don't. Government-sponsored health care would lead to